Hey, it's a disease you may have never heard of before, but it could affect one or both of your hands. Here to explain it is Dr. John Dietrich from the Crystal Clinic. Now, doctor, I got to tell you, this is a disease I've never heard of, and I can't pronounce it.
Well, it's called Dupuytren's contracture or Dupuytren's disease, and it's more common than you think.
Okay.
It probably affects 4 to 6% of the population.
Okay.
And in a nutshell, what is it? It means your fingers start to curl up.
Okay.
And it's actually a genetic disease. You can see on these photos right here, it most commonly affects the ring finger and then the little finger. And it usually starts with a nodule. We see many patients that come in that first say they have a lump and their family doctor sends them, they think it's a ganglion, and it's not.
So it's not something that someone does to cause it, it's something, is it hereditary?
It is heredity, but it is not like blonde hair or blue eyes where it's a simple dominant recessive problem.
Okay.
This is what's known as multifactorial. There's multiple genes. Men are much more common, probably 3 to 1 to get it versus women.
Okay.
It starts usually in their late 50s or early 60s that they get it, and women are a little bit older when they get it. But it starts with just sort of a lump in their hand, and then it gets progressive to a point where they then can't put their hand flat,
Okay.
put it in their pocket,
Wow.
put gloves on.
So what do you do for these unfortunate souls?
Well, first of all, Dupuytren's is not curable,
Okay.
but it's treatable.
Okay.
And the mainstay of treatment used to be surgery.
Okay.
And now we treat this with injection is really taken over. There's another, and the injection is what's called Xiaflex.
Okay.
And Xiaflex, it's kind of like Botox's cousin. It's a combination of 2 bacterial toxins, and we mix them together. We inject it into the diseased area.
How many treatments, is it like a normal course, or is it different for everybody? Like how many injections would you have to get?
It's regulated by the FDA of how many injections you can do.
Okay.
A year ago, you could only give or use 1 vial at a time, and you had to wait at least 30 days to do the second one.
Okay.
Now we can use 2 vials at once.
Okay.
So you can treat more than 1 finger.
All right. But if, like, after you get a treatment, is it one treatment and that finger will be better, or do you have to get multiple treatments to get that finger better?
Great question. In most people, I would say they require more than 1 treatment,
Okay.
especially if they have fairly advanced disease.
Okay.
So it's not just that we inject this stuff and you're better. You have to inject it, give this medication time to work, and then we bring people back and we manipulate it.
Okay. So what they need to do is say, if I have this condition, we need to get in touch with Dr. John Dietrich.
Absolutely.
All right, at the Crystal Clinic.
Correct.
And that's crystalclinic.com/ with that Summit Hand?
Summit Hand Center.
All right, very good. Thank you, doctor.
Jimmy,
All right,
thank you.
I'm glad I can shake your hand. We'll have more New Day Cleveland right after this.